1. The FDA Modernization Act of 1997 amended CLIA 1988's criteria for wave testing to state that Select 1A. An associate degree is required for testing. B. Tests performed at home must be approved by the state. C. The procedures perform methodologies that are so simple to perform and accurate as to render the likelihood of erroneous results by the user negligible. D. All operators must be licensed in their states. The answer is C. The procedures perform methodologies that are so simple to perform and accurate as to render the likelihood of erroneous results by the user negligible. 2. Based on electrophoretic principles are used in the clinical laboratory to perform all of the following except 2. Select 1A. Measure quantities of various proteins in plasma, urine, and CSF. B. Separate enzymes into their component isoenzymes. C. Identify antibodies. D. Measure molecules in a characteristic spectrum called the emission spectrum. The answer is D. Measure molecules in a characteristic spectrum called the emission spectrum. 3. Which of the following electrophoresis support materials separates proteins on the basis of charge and molecular size? Select 1A. Cellulose acetate. Agarose gel. Polyacrylamide gel. Starch gel. The answer is B. Agarose gel. 4. In order for a laboratory to handle TB sputum and TB materials, the laboratory must operate to render the likelihood of erroneous results by the user negligible. Select 1A. Biosafety level of 2+ or 3. B. Biosafety level 4. C. Location where air exchange is continuous. D. Location where fume hood exhausts are monitored daily. The answer is A. Biosafety level of 2+ or 3. 5. Prohibiting mouth pipetting is an example of Select 1A. A workplace control. B. An engineering control. C. A best practice in the workplace. D. A human resources requirement. The answer is A. A best practice in the workplace. 6. The new safety data sheets, SDS, will require blank specific sections, ensuring consistency in the presentation of the information. Select 1A. 16B. 10 circa 25D. 12. The answer is A. 16.7. All of the following are bloodborne pathogens except Select 1A. Hepatitis B virus, HBV, B. Hepatitis C virus, HCV, C. Human immunodeficiency virus, HIV, D. Epstein-Barr virus, EBV. The answer is D. Epstein-Barr virus, EBV. 8. Which of the following uses a graphite cylinder to hold the sample? Select 1A. Flameless atomic absorption spectrophotometer. Atomic absorption spectrophotometric. Isoelectric focusing. D. Anodic stripping voltammetry. The answer is A. Flameless atomic absorption spectrophotometer. 9. Which of the following is the key membrane component for a potassium selective electrode? Select 1A. Tobramycin. B. Valinomycin. Ch. Gentamicin. Vancomycin. The answer is B. Valinomycin. 10. Creatinine clearance is reported in units of Select 1A. Milligram per liter. B. Milligram per deciliter. C. Milliliter per hour. D. Milliliter per minute. The answer is D. Milliliter per minute. 11. The IDMS traceable MDRD equation for the estimation of GFR includes serum or plasma creatinine results and which three other variables? Select 1A. Age in years, protein in mg, and BMI. B. BMI, gender, and weight in kilograms. Gender, age in years, and race, African American or not. D. Race, African American or not. BMI, age in years. The answer is C. Gender, age in years, and race, African American or not. 12. A high protein diet may cause a Select 1A. Prerenal plasma urea increase. B. Postrenal plasma urea increase. C. Prerenal plasma urea decrease, D. Postrenal plasma urea decrease. The answer is A. Prerenal plasma urea increase. Increased total bilirubin, increased conjugated bilirubin, and increased unconjugated bilirubin could be expected to be seen with a patient who has select 1. A. Prehepatic jaundice, B. Posthepatic jaundice. Crigler-Najjar syndrome. Rota syndrome. The answer is B. Posthepatic jaundice. 14. Glucocorticoids, and which of the following are produced by the adrenal gland and are responsible for increasing plasma glucose? Select 1. A. Insulin, B. Thyroxine. Epinephrine. Somatostatin. The answer is C. Epinephrine. 15. With which enzyme does carbohydrate metabolism begin? Select 1. A. Pancreatic amylase, B. Lactate dehydrogenase. Salivary amylase. Phosphofructokinase. The answer is C. Salivary amylase. 16. Which rises first in response to inflammation? Select 1. A. Haptoglobin, B. Ceruloplasmin. Transferrin. C-reactive protein. The answer is D. C-reactive protein. ALT is assayed primarily to evaluate which of the following? Select 1. A. Kidney disorders, B. Hepatic disorders, C. Thyroid disorders, D. Cardiac disorders. The answer is B. Hepatic disorders. 18. The relationship among enzyme, substrate, and product may be expressed as select 1. A. E plus S right pointing arrow ES right pointing arrow E plus PB. P plus S right pointing arrow E plus PC. E plus S right pointing arrow ES right pointing arrow EPD. E plus S right pointing arrow E plus P. The answer is A. E plus S right pointing arrow ES right pointing arrow E plus P. 19. Elevated levels of which of the following enzymes may indicate chronic alcoholism? Select 1. A. AST, B. ALT, C. GGTD. GST. The answer is C. GGT. 20. Elevations in ALP levels are seen in hepatobiliary and which other disorders? Select 1. A. Kidney. Lung, C. Pancreas. Bone. The answer is D. Bone. 21. Which of the following is produced in the alpha cells in the islets of Langerhans in the pancreas? Select 1. A. Insulin, B. Glucagon. Glycogen. Epinephrine. The answer is B. Glucagon. 22. In which of the following organs does PTH act to enhance the 1-alpha hydroxylation of 25-hydroxy-vitamin D? Select 1. A. Boneb. Liver, C. Kidneys. Skin. The answer is C. Kidneys. 23. Which of the following is the common precursor for all adrenal steroids? Select 1. A. Cholesterol, B. 11-deoxycortisol century epinephrine, D. Dehydroepiandrosterone. The answer is A. Cholesterol. 24. Which of the following serum lipoprotein concentration patterns is seen on average with premenopausal women when compared with men? Select 1. A. Lower HDL-C and higher total cholesterol and triglyceride levels, B. Lower HDL-C and lower total cholesterol and triglyceride levels, C. Higher HDL-C and higher total cholesterol and triglyceride level, SD. Higher HDL-C and lower total cholesterol and triglyceride levels. The answer is D. Higher HDL-C and lower total cholesterol and triglyceride levels. 25. How long is the required patient fasting time for triglyceride testing? Select 1. A. 6 hours, B. 12 horse. 8 hours, D. 10 hours. The answer is B. 12 hours. 26. Ionized calcium is measured on automated systems by which of the following methods? Select 1. A. CPCB. AASC. TLCD. ISE. The answer is D. ISE. 27. Hyponatremia with normal osmolality may be seen in patients with which of the following? Select 1. A. Increased water retention, B. Hyperglycemia C. Hyperlipidemia. Increased sodium loss, the answer is C. Hyperlipidemia. 28. Which of the following is a semi-synthetic opiate with 2-3 times the analgesic potency of its parent compound, morphine? Select 1. A. Codeine. B. Fentanyl. Heroin. D. Tramadol. The answer is C. Heroin. 29. Chronic exposure to organic mercury is cumulative because most of it is bound to which of the following? Select 1. A. Adipose tissue. B. Neuronal proteins. Renal tubules. D. Splenic tissue. The answer is B. Neuronal proteins. 30. The purposes of TDM are to ensure that the drug dosage provides the maximum therapeutic benefit and which of the following? Select 1. A. Identify the standard dose. Identify when the drug is outside the therapeutic range. Determine the efficiency of absorption. Determine the route of administration. The answer is B. Identify when the drug is outside the therapeutic range. Which of the following is a functional test used to assess fetal lung maturity? Select 1. A. LS ratiob. PGC. FSID. Lamellar body counts. The answer is C. FSI. 32. The dose that would be predicted to produce a toxic effect in 50% of a population is represented by which of the following? Select 1. A. ED50B. LD50C. TD50D. ID50. The answer is C. TD50. 33. Which of the following is the method of choice for confirmation testing following a positive opiate drug screening result? Select 1. A. AASB. HPLCC. Immunoassay. D. GCMS. The answer is D. GCMS. 34. The observation of oligoclonal bands on CSF protein electrophoresis but not on serum protein electrophoresis is indicative of which disorder? Select 1. A. Hypoglyceratia. Otoria century multiple sclerosis. Ascites. The answer is C. Multiple sclerosis. 35. The integrity of the blood-brain barrier may be determined by which index? Select 1. A. CSF, serum albumin. B. Serum, CSF albumin. CSF, IgGD. IgG, CSF. The answer is C. CSF, serum albumin. 36. Which of the following is a good indicator of chronic malnutrition? Select 1. A. Transferrin. B. Transtre-retinc. C. Reactive protein. Albumin. The answer is D. Albumin. 37. Which of the following determinations is used to assess the total body lead poisoning burden? Select 1. A. Zinc protoporphyrin. B. 1,25-dihydroxyvitamin DC, GFRD. Whole blood lead. The answer is D. Whole blood lead. 38. Which is the specimen of choice for arsenic, if the exposure took place less than 1 week ago? Select 1. A. Urine. B. Hair or fingernails. C. Whole blood. D. Serum or plasma. The answer is A. Urine. 39. Counting with a hemocytometer requires select 1. A. Any 22 by 40 mm. Cover glass. B. Any 22 by 22 mm. Cover glass. C. A 1 by 3 in. Glass slide. D. A hemocytometer cover glass. The answer is D. A hemocytometer cover glass. 40. Peripheral erythrocytes. Select 1. A. Are the most numerous. B. Are biconcave discs. C. Have a color due to hemoglobin. D. All are true. The answer is D. All are true. 41. Immersion oil is routinely cleaned from the select 1. A. Diaphragm. B. Oculars. C. Nosepiece. D. Objectives. The answer is D. Objectives. 42. In humans, a white blood cell is also known as A. N. Select 1. A. Carbonocyte. B. Erythrocyte. C. Thrombocyte. D. Leukocyte. The answer is D, leukocyte. 43. Blood capillaries carry select 1. A. O2 to the cardiac veins. B. CO2 to the lungs and tissues. C. O2 to the tissues. D. CO to the cardiac veins. The answer is C, O2 to the tissues. 44. Blood capillaries carry select 1. A. O2 to the cardiac veins. B. CO2 to the lungs and tissues. C. O2 to the tissues. D. CO to the cardiac veins. The answer is C, O2 to the tissues. 45. The body maintains an adequate number of cells to perform its functions and is referred to as tissue, blank, underscore select 1. A. Differentiation. B. Homeostasis. C. Commitment. D. Maturation. The answer is B, homeostasis. 46. Dacryocytes is the proper name for select 1. A. Sickle cells. B. Teardrop cells. C. Mouth cells. D. Spherocytes. The answer is B, teardrop cells. 47. A hemoglobin analysis select 1. A. Measures the PCV, an indirect test. B. Is an oxygen carrying capacity test, an indirect test. C. Is not affected by the PCV, a direct test. D. Is only be done directly on A1 hemoglobin of newborns. The answer is B. Is an oxygen carrying capacity test, an indirect test. 48. Human hemoglobin is mostly found in the select 1. A. Platelets. B. Leukocytes. C. Erythrocytes. D. Plasma cells. The answer is C, erythrocytes. 49. A group of anemias that demonstrate mild to severe microcytosis and hyperchromia are disorders in the synthesis of globin, a component of the hemoglobin molecule, and are a group of inherited disorders of hemoglobin synthesis. Are select 1. A. Iron deficiency anemia. B. Hemolytic anemia. C. Sideroblastic anemia. D. Thalassemias. The answer is D, thalassemias. 50. RBCs with anisocytosis have various select 1. A. Shapes. B. Sizes. C. Colors. D. Depths. The answer is B, sizes. During the diff, RBCs are observed to vary significantly in size from the nucleus of a mature lymphocyte. The TEC will describe these RBCs as A. Anisocytosis. B. Poikilocytosis. C. Hyperchromic. D. Megaloblastic. The answer is A. Anisocytosis. 52. Reticulocytes are immature RBCs which still contain in the cytoplasm pieces OFA. Ribonucleic acid. B. Deoxyribonucleic acid. C. Mitochondrial coils. D. Nucleoli. The answer is A. Ribonucleic acid. 53. Which stage of neutrophil has a nucleus with fine chromatin nucleoli and a granular cytoplasm? A. Metamyeloblast. B. Myeloblast. C. Promyelocyted. Prometamyelocyte. The answer is B. Myeloblast. 54. The eosinophil granulocyte has red staining granules in, on, ITSS. Elect 1. A. Nuclear filament. B. Nucleus. C. Cytoplasm. D. Cell membrane. The answer is C. Cytoplasm. 55. When counting platelets using the UNOPIT system, a manual method, which area is used to count on the Neubauer hemocytometer? Select 1. A. All 9 square SB. Large center square C. 4 corner squares D. 4 corner squares of the center square. The answer is B. Large center square. Thanks so much for watching. Please don't forget to like, share, comment and hit the subscription bell below. You are appreciated.